Welcome, folks. Greg Murphy here with Seton Medical Center. I'm sitting with Angelica Malicon Hooper, PharmD, clinical pharmacist. She's my colleague here. And we appreciate you guys taking time out of your day to come out in the nasty weather to listen to us talk. We want to make this a give and take. This is your lecture, it's not ours. And we'd like for you to feel free to stop us at any time and ask questions. This is for you. And so we want to be as informative. At the same time, we want to make sure you get all your questions answered. So we have a little outline we're going to go through. It won't take long, but we want to focus on safety with your prescription drugs. We have some little tidbits of information to give you about interactions and herbal supplements and drug interactions and things like that. So we'd like to go through our outline, and you can stop us at any time and ask questions if you like. So we'll just go ahead and go to our first slide. One of the important things about prescription medications is to take it as prescribed. And you've been going to your primary care physician or your internist for some clinical indication that you need help with, and they've prescribed a medication for you to help that. And some of these medications need to be monitored by lab work. They need to be monitored frequently by you coming in for physical exams. And the most important thing is to make those appointments to get the lab work and get those physical exams so you can get the most out of your prescription medication. We want you to always be truthful about all your prescribed meds, over-the-counter medications, and supplements you're taking. If you leave something out, your provider and your pharmacist can help you make proper decisions if you leave any important information out. And you also want to provide your provider and your pharmacist with your true allergies. And I want to add the word true in there because a lot of people have problems with medications that are intolerances, like stomach upset, diarrhea, a headache or whatnot, but it's not a true allergy that can put you in a unsafe situation. So it's important that we put a firewall between intolerances and allergies, because if you have a true allergy to a medication, that sometimes prevents you from ever taking that medication. I'm going to let Angelica take the next bullet point.
Okay, as far as like pharmacist instructions, your provider will give you your prescription and tell you how to take it. But then when you go pick up your prescription, the pharmacist is a great resource and a help to you. They do offer you patient counseling. Now, if this is a new medication to you, you want to make sure that you get the most out of it. So always, I would suggest that you always take that patient counseling, because that pharmacist will let you know about any potential interactions that may be present, looking at your profile and looking at what other medications you are taking. And don't feel rushed, because I know these pharmacies can be very busy and you may have long lines of people waiting there, but it's a pharmacist's responsibility to offer to you that counseling. And if you do that, then you'll know how to take your medication, and the pharmacist will discuss potential side effects, something that could be harmful to you and something that you can avoid. So they are there to help you take everything safely. They will also tell you how to store your medication. And another thing too, as far as when you get your medication, not only will, if you look at that prescription label, it'll also tell you what should be in your bottle. So nowadays, there'll be a description of the pill on that label and what it should look like, because every pill will be of a certain size, a certain color, and there may be imprints on one side and on the other. And usually that information is on your label. So if you open up your pill bottle, it should match. If it doesn't, it would be a good idea to ask your pharmacist, hey, am I getting the same medication? Because it used to be a little yellow pill and now it's a little pink pill. But it could be that The pharmacy has changed manufacturers, but it's always a good idea to make sure, am I getting the right medication? And there will also be other labels on there that tell you, um, potential areas where, it might be a medication that tells you you have to stay out of the sun if you take it. Don't take this with alcohol, take it with food. So a pharmacist will go over that with you. And I think it's a good idea that you do talk to your pharmacist before you walk out the door, because usually it's when we walk out the door that we actually have all these questions. So don't be intimidated. It's your right to have that conversation, and don't feel pressured. And so another thing too, don't take medications that a provider has not prescribed you, because you may say, oh, hey, this is working for my friend, or this is working for my aunt. But you know what? Every medication is specifically for you. So don't take anything that your provider has not prescribed.
So many special considerations when a provider prescribes medication to you. A lot of medications act differently in the young versus the old. So your age, and I'm in that age where I have to consider physical changes in my liver, in my kidneys, in my eyes. And those are going back to the first slide. When you have physical changes, you need to make sure you get your frequent lab exams to see if your medications are not being detrimental to your body. I'm going to go down to drug-drug interactions and leave the over-the-counter herbals for Angelica to discuss. With regards to drug-drug interactions, there are no perfect drugs, and most of us take more than one drug. And a lot of drugs don't play well with other drugs. Again, having those conversations with your pharmacist, being honest. Picking one pharmacy is important because they will have your medication history in one place, and they can see the interactions that are possibly happening. Also, being honest with your provider about prescriptions that you're receiving from other providers can help guide your provider. There are certain drugs like Viagra, Cialis, opioids that will interact with medications like nitrates and can crash your blood pressure down to unsafe levels. So again, laboratory monitoring, blood draws, making sure that you're seeing how the medications are acting within your body, and making sure you get those blood draws done. Angelica is going to talk about over-the-counter medications.
As far as over-the-counter medications, herbal preps, and supplements, we'll start with the over-the-counters. The over-the-counter medications, you can come into your pharmacy, and again, if I go back to the role of a pharmacist, if you walk into those like your local pharmacies, they can help you pick out a product. Just because they're behind the counter doesn't mean they can't step away from it. They can come out into the aisles with you. Say you're looking for a certain type of cough medicine, or say you're looking for an antifungal. They can come out, walk the aisles with you, and help you. But I think sometimes, pharmacists, when they seem to be very busy and you don't want to bother them, but if you need help, it's your right, and it's for your help. So it's something that pharmacists, we're trained to do that, and we gladly do that when we're asked. And I know Greg had emphasized how you're supposed to be truthful with your providers about everything that you're taking. And sometimes you may think, well, it's an herbal supplement. It's something that I, bought, and I don't think this is something that's really considered a medicine, so I just won't mention it. But guess what? Some of these herbal supplements can have deleterious effects when combined with other meds. Let me just go over a few. We've all heard of echinacea. That is something that maybe can help us with a common cold. But if you have some type of autoimmune disease, in which, for example, rheumatoid arthritis or lupus would fall into that category, well, echinacea can actually make your autoimmune disease worse. So that would be something that your provider would need to know. Are you taking echinacea? How about ginkgo biloba? Ginkgo biloba is something that's been touted as helping with memory and also helping with, circulation. But that medication can actually interact with blood thinners. So if any of you are on Coumadin, well, now you're adding the ginkgo biloba, and now you're at an increase for bleeding. Same is true when you're taking other medications like aspirin and ibuprofen. Saw palmetto is also a medication that has recently been used to treat like enlarged prostate. So many of you in the audience might, have BPH, also known as benign prostatic hyperplasia. So if you're taking the saw palmetto, thinking you're treating that, but if you're also taking a blood thinner like the Coumadin, also known as like warfarin, or if you're taking any aspirin or ibuprofen, again, you can fall into the category where now you've set yourself up to be at a risk of bleeding. And St. John's wort is also another one that's very popular, can help with depression. But one thing about this particular supplement is that it causes some type of photosensitivity, which means if you're taking this medication, you have to stay out of the sun, or you have to wear protective clothing, because now you're taking this medication, and every time you're out in the sun, you can actually start getting some type of sunburn from it. It's called photosensitivity. And when you mix St. John's wort with something like cough medicines or antidepressants, and this is very important for those of you who are on antidepressants, and if you're considering taking this, well, there is a chemical in the body known as serotonin. Now, if those levels become too high, it could actually be so dangerous that it can throw you into something as maybe mild as shivers and diarrhea, but you can also end up with severe muscle rigidity and even seizures. And for people whose levels are so high, it could actually cause death. So you have to make sure that your providers, not only the pharmacist, but also your doctor, knows everything that you're taking. And some supplements, especially if you get these commercials where they're trying to tell you, oh, this will help you with weight loss, this will help you with trying to increase your muscle mass, this will treat erectile dysfunction. Well, some of these meds have actually been found to be tainted with even prescription products, or even things like lead. So anything that you buy over the internet, please be very careful. And also, there are some supplements that aren't even worth the risk. Some supplements are actually quite dangerous. I don't know if any of you are familiar with something called kava, but kava, they tout it as something that helps reduce anxiety, but this can actually interfere with your liver. It can damage your liver. It could actually make Parkinson's disease worse, and it could even cause exacerbations and depression. And something else like red yeast rice. I've heard of that. It's supposed to help with cholesterol, but beware, because this can also damage your kidney and liver. So try to stick with something that your doctor, if you are considering taking any of these preps, please talk to the pharmacist, please talk to your doctor. If they okay it, then that's up to the provider. But if you're taking it on your own, please make sure that you let your providers know what you're considering taking.
And I like, if I might add one thing to the over-the-counter topic. Just because it's over the counter and you're not getting a prescription for it does not remove it from the complexity of all the biochemical things that can happen in your body. I'd like to add one thing to the supplements. You go to these nutrition places, you're working out, you want something for more energy. You see the commercials on television for more vitality and more youth. A lot of those substances have testosterone type derivatives in them. And if you're one of those males, as Angelica mentioned, that has benign hypertrophy of the prostate, that can make that exponentially worse, because the testosterone will feed the growth of that particular entity within your body and make it much worse. And you think you're doing something good by buying something that's going to give you energy or strength at the gym, but it can actually exacerbate a problem that you have, and you might not even know what's going on. So we'll go to the next slide. This is kind of a topic that I wanted to put in today's lecture. I spend 10 hours a day in the emergency room, and we have people come in all hours of the day and night. And some of the people need emergency treatment, and some of the people are admitted to the hospital. And they don't know what they take prescription wise or over the counter wise. And in order for us to take good care of you at Seton Medical Center, we need to know what prescriptions that you're taking and over the counter medications that you're taking. We'd like to provide those to you while you're here to maintain continuity with what you're taking at home. But if we don't know what you're taking, we can't help you. So I wanted to go over a couple little things that can help you. We're in the internet and digital age. Most everybody carries an iPhone or an Android. There are places in those phones that are built into the technology where you can put everything about your health. You can put your blood type, your prescription list, your emergency contacts, and anybody can get at that screen, even if your phone is locked. A healthcare provider, knowing their way around the phone, can get in there and find out what you're taking if you can't talk to us. A lot of people come here late at night and they're very ill and they can't talk to us. Another thing is make a written list, laminate it, shrink it down, put it in your purse, put it in your wallet. Always leave a copy with a trusted friend or family member. If they bring you to the hospital, or we can call them and get that information from them. So what do we want on your list? What do we want to see in your phone digitally, or what do we want to see on the list that I've just asked you to make? We'd like to know the medication, brand name and or generic. We'd like to know the strength of that medication. We'd like to know the directions or frequency, how you take it. And if you'd like to add an additional line, why you're taking it, like I'm taking a torvastatin for high cholesterol, or I'm taking metoprolol for high blood pressure. That's also good information for us to know. The bottom line on the medication list is have a medication list. That's the best thing you can do for taking control of your own health care. And with COVID right now, we can't send out for visitors. We can't send out for all your medications. We can't allow those tracking of people in the hospital that we don't know are in here. They may be bringing COVID in. So to keep you safer from now until eternity, we have these viruses now, and there's probably another one behind COVID that we don't even know. So if we make those habits now, we'll keep you safe in the future.
Okay, I know Greg has touched upon some of the drug interactions, how one drug may affect another. Like for some of you who may be, taking some pain medication, some type of a opioid medication, that would be important to not mix any other drugs that can make you sleepy. For example, like you wouldn't want to mix some Valium with that. You wouldn't want to mix alcohol with that, because that can definitely cause severe sedation, severe respiratory depression, and it could actually send you into a coma. So you have to make sure that when you are taking any type of pain medication, that you follow the instructions exactly as written, because sometimes you may say, oh, but I still have pain. Let me just take more. Let me just take more. But if your pain is such that what you think you have is not working for you, you definitely need to contact your provider and have that discussion. And it could be that the provider may add something else, another type of medication that can help you, ease the effects of it, or you could get switched to another medication. And also with, you might have some medical conditions that can make certain drugs harmful. I know Greg has touched upon the renal and hepatic issues, because as we do age, it's just natural that where our bodies are not going to be the same as when we were teenagers. So it may take your body longer to break down a medication. It's still doing the job, but it might take longer. So, like here in the hospital where we work, we providers always order medications for their patients, and they do give us the freedom on certain medications like antibiotics that we look at the patient, look at how their kidneys are functioning, look at how their liver is functioning, and if we need to make an adjustment in the dose, in how often it is given, that is something that they have allowed us to do. And so doctors will often come to us and ask for recommendations when they're sending a patient out for an outpatient prescription. And we do look at how a patient is clearing something. And so we will make those adjustments. So instead of taking maybe 100 milligrams, we'll tell the doctor, well, let's just give them 50 milligrams. If they're taking it 3 times a day, we may say, oh, for this patient, they're only able to have it once a day, but the medication is still effective. But now we are providing that safety net to make sure that you're not getting too much and, and causing more harm to your kidneys or to your liver. And I know Greg had also talked about how important it is to go and get your lab work, because there are, when you do your lab work, guess what? The doctor is also looking at, how your kidney is functioning. And so based on that, for example, some of you may, be diabetic, and you may be taking the medication metformin. Well, metformin is a medication that may need some type of renal adjustment. And so the doctor, when they do your labs, they're looking at things like that. So it's not just like they're taking labs to have them in your record, but they're reviewing it and making sure that that everything is still accurate. And there are also food and alcohol or alcohol interactions with your medications. So again, we're going back to the importance of having conversations with that pharmacist, especially during counseling. Usually if it's a new prescription for you, it will be offered. They say, oh, do you want counseling? Please don't be intimidated and say, well, no. If you need it, take it, because they may have the discussion and tell you certain medications, believe it or not, if you take with grapefruit juice, it can actually not allow that medication to get cleared the way you would expect it to get cleared. Also, if you're taking potassium supplements that may be mixed in with medications that already cause an increase in potassium, well, that can cause trouble, because if you have too much potassium, that can actually affect how your heart operates. So that's a conversation you would need to have. And for those of you who are taking blood thinners like Coumadin, I know one thing that is like an absolute, the pharmacist will always discuss with you foods that are high in vitamin K. For example, Brussels sprouts, broccoli, spinach, all those foods are high in vitamin K. But if you take these foods with your Coumadin, they kind of work against each other. So this Coumadin that you're taking as a blood thinner, all of a sudden won't be doing the job that it should be. Now, I know some pharmacists say you need to be consistent in your diet. If you're going to eat those green leafy vegetables, you can do it, but your doctor needs to know that you're consistent in doing it, because they may adjust your dose of Coumadin based on your intake of of the foods rich in vitamin K. So basically what I'm saying is, if you're doing your Coumadin, don't all of a sudden go out and eat a ton of vitamin K, because you can run across problems. Another thing too is calcium. Calcium is also, it's good for us. I love calcium. I love, drinking a lot of milk and eating yogurt. But if you're taking something like an antibiotic like tetracycline, well, the calcium can interfere with that. So the pharmacist will counsel you and say, okay, if you're going to do that, try taking your medication either an hour before or maybe 2 hours after you've had that calcium, to kind of keep them as far apart as possible. And then this is something that can be surprising. I myself like red licorice, but there are a lot of people who like black licorice. And the real black licorice actually contains a chemical called, I don't even know how to pronounce it correctly. It's glycyrrhizin, and this can actually interfere with digoxin. So people who are taking digoxin and take a lot of this black licorice may, without knowing it, be causing this accumulation to the point where now you're going to start getting irregular heartbeats. So there are certain foods, that you will be counseled to be cautious about when you do pick up your prescriptions. So, I keep going back to, talking to your pharmacist, but, it really, you can learn a lot from just that initial conversation.
So review your medications with your healthcare provider, and that means your physician and or your pharmacist. Angelica's mentioned several times about having a discussion for counseling. Take that counseling. Take an extra 5 minutes and get up to date with all the things that are going on with especially your new medications. Our bodies change along the way. Sometimes we have procedures that require us not to take medications anymore. For men who have their prostate removed, you may not need medicines that shrink your prostate anymore. So it's good to do a medication review every now and then and see if your medications are still necessary. I'm not in any way hinting that you need to decide that they're not necessary. Let your provider decide whether they're not necessary. But what I'm trying to make the point about is just blindly going down the road and just continually refilling and taking medications forever and ever, and never going back over those at least annually with your provider. Drug cost. A lot of people quit taking medications because they can't afford them. There are many ways to get inexpensive medications. There are coupons. I know that Walmart has a $4 or $5 prescription program. You just need to ask your provider, is this prescription available in a generic? If they prescribe a brand name, always ask if there's a lower cost generic available, because if you don't take that medication, it's not going to do you any good. Along those lines, if a medication is expensive, and used to talk to my own mother and father about that. They came from the Depression era, and they would try to make things last, and they would split tablets to make them last, and that's not good, because you're getting half of what you need. You may be able to get it twice as long, but in the end, you're really doing yourself a disservice, because that medication is not doing what it was prescribed to do at the dose that was prescribed. So go over your drug cost with your primary care physician before you leave his office. Go over your drug cost with your pharmacist. And there are coupons and there are applications for iPhones and Androids. GoodRx is a good resource for coupons where you can get expensive drugs and get $40 or $50 knocked off that prescription right there at the pharmacy. One thing when I worked retail pharmacy that used to kind of drive me crazy is that folks would come in and they would be taking their prescriptions to 2 or 3 different pharmacies, maybe to get a better deal here or there. it's in your best interest to pick one pharmacy and stick with that pharmacy because they'll have all of your history right there in their computer. That also goes with multiple providers. If you have rheumatoid and you're seeing a rheumatologist, and you have bad knees and you're seeing an orthopedic specialist, and you have a bad heart and you're seeing a cardiologist, all of those people don't always share their histories and physicals with each others. And sometimes they do. And for some reason, digitally, their office doesn't receive that data. So it's always good when you're visiting with the intake nurse at your provider's office and or your physician, always share with them that you're seeing Dr. X for rheumatology and Dr. Y for orthopedics and Dr. Z for cardiology, and let them know what you're taking and why you're seeing those particular specialists. So we're going to do some closing remarks here, and we'd like to see if you all have any questions when we're done. Angelica will take over here.
Some of you may have a lot of medications, like maybe you kept refilling them and maybe you weren't taking them and somehow your medications have now expired. The way when a manufacturer makes a medication, they are going to stamp it with a certain date. This is how long this medication is good for. And so when your pharmacist pours out the medication into a little pill bottle for you to take as an outpatient, they are going to put a date on there. And that date will be the date where the pharmacist has determined that your medication will expire. Please do not keep any expired meds around the house thinking I'll take some maybe later, I'll have it on hand. Because once a medication has expired, there is no guarantee that that medication is safe or that it will maintain its potency. Some medications can actually break down. They can break down. Something like an antibiotic like tetracycline can actually break down, become toxic. And then if you ingest it, it can actually damage your kidneys. And if there are meds like, say, if you have allergies and you carry around an EpiPen or insulin, if they're kept for too long, those can also lose their potency. So if you have medications around, once they are expired, I would consider them to like not be something that you should be taking. There is a website called disposemymeds.org. I was actually on it a few days ago, and if you type in your zip code, it can direct you to where you can go and dispose your meds. We really don't want you to flush them down the toilet. Nowadays there are a lot of options. It's my understanding that even if you go to the Walgreens, some of the pharmacies, they can give you some information. Sometimes you can actually drop off your meds there. You know, they may have some drop-off boxes. I know this past weekend, there was a National Prescription Take Back Day, and that is something that happens annually. And normally you're able to take your meds that you want to get out of your house and you want to just drop them off at like a fire station or a police station. Like I said, I know we just had that this weekend and it comes back annually. But you don't have to wait a whole year to try and get rid of meds. You know, if you try and ask your pharmacies, your local pharmacies, if they know of any places, or you can go online and go to the disposemymeds.org and see if they can help you there. Other tips that we have for you. When you come into the pharmacy, maybe you have arthritis, maybe you are not able to actually open up your pill bottle. You know, as a pharmacist, can I get a cap so that's easier to open? If you do get one of those caps, because most caps now they're child safety, so they're very difficult to open. But a pharmacist will be able to give you a cap that you can open. But if you have children around the house, you have grandkids, definitely keep these meds out of their little hands. Because something that we can tolerate can definitely be lethal in the wrong hands. And another thing too is like, well, you need to store your medications. And a lot of people have the misconception that it's okay to, to store your meds in the bathroom. But believe me, the bathroom can be a place that's very humid. There can be temperature variations. And some medications actually can react to that and also lose their potency. You most likely want to keep them in a cabinet, but I wouldn't really recommend that you keep them in the bathroom that can get hot and steamy. But you need to find a place that you can access, but that little kids can't access. Another thing too, maybe you have difficulty swallowing, and maybe the doctor has provided you a pill, but you may be able to get that switched over quite easily if there's a liquid formulation available. Just ask your doctor. Sometimes they can dispense either one. Another thing also is some medications aren't meant to be chewed, they're not meant to be broken, and they're not meant to be crushed. Those medications are most likely extended release that are meant to last you a whole 24 hours, or they could be a sustained release formulation that maybe you take twice a day. So that's one thing, again, when you talk to your doctor, he will tell you, because some medications, you have to swallow them whole because just of the way they work, they're slowly released over time. These extended release formulations are supposed to last you 24 hours, but once you start chewing and crushing them, you can actually, that can actually be harmful to you. Any more?
Yeah, I'd like to say one thing. I liked the topic today was safety with prescription drugs. I'd like you to take 30 seconds and pretend when you get home what you would do if you had to leave the house quickly for a fire, for a hurricane, for a heart attack, for a stroke, what you would do when you got to the other side of where you were going safely, to the hotel, to the hospital, to wherever. How would you convey your list of medications to another person, a pharmacist, a physician, a hospital, if you had to leave your prescriptions behind and all you could grab was your purse and your pants and your wallet and your phone? So that's what I wanted to convey to you. Put those lists in writing, put them digitally in your phone, so that when you grab those items and you're taking life and limb out the door to wherever you're going from point A to point B, that you have all of the information to help you with your patient safety wherever you're going, with leaving everything behind. Just pretend that for a moment, what you would do if you had to just leave your house immediately. Would you have the information about your blood type, your prescriptions, why you're taking them, the strength, and everything for that person on the other end to help you and help keep you and your family safe? So with that, we'll close out our lecture here today, and we'd like to open the floor. If there's any questions, feel free to ask us whatever you'd like, and we'll see if we can answer it. Okay, so I guess we're done. Thank you all for having us.
Thank you very much.
Thank you.
And stay safe.